everyone, welcome to pharmacology lectures. Today we will going to see about bioavailability. It is one of the important topics in pharmacokinetics. Let's see in details. Now what do you understand by bioavailability? The definitions are different. It's basically rate and extent of absorption of a drug from dosage form. Now it looks bit tricky, but let me explain. If you have introduced any drug, for an example, you have introduced the drug in tablet form. Now this tablet gets absorbed from the intestine and reaches to the systemic circulations. So at which rate it gets absorbed and how much it got absorbed from the intestine and reach to the systemic circulation, that is called as bioavailability. So the fraction of administered dose of a drug that reaches to the systemic circulation in unchanged form. Now why this is important? Because we know that if we introduce drug orally, first it gets exposed into portal circulation to liver, and in liver there is a mechanism called as first pass effect. So with this first pass effect, if we introduce 100% of a drug, there are chances that certain amount of drug, for an example 20%, gets metabolized and only 80% reaches to the systemic circulation. So this 80% is bioavailability. So now if we see this chart, what it says, it's showing two figures. You see, one figure is showing the graph in this shape, and this is after oral administration. This graph is showing a drug amount after oral administration, because when you administer orally, the concentration of that particular drug increases. Eventually it comes to a state from where the drug concentration get decreases because of metabolism and eventually excretions. But what if you introduce drug intravenously? If you introduce drug intravenously, the concentration would be pretty high and eventually it decreases because of metabolism and excretion. So this is a graph of intravenous administration, and this is a graph after oral administration of bioavailability. This graph showing in detail about different aspects of bioavailability. Now in this graph, if I tell you what's been interpretations, there are multiple points. Now what it's showing is, first this is time here, and this is amount of drug in the blood, or rather we would say concentration of a drug. So concentration versus time curve is been showing. Now where is bioavailability? We know that drug here, the drug is been taken, eventually the concentration of drug rises in the body and eventually it comes to the peak state, and then after, because of the metabolism and eventually excretion, the concentration decreases. These are multiple points I have dictated here that you can also remember as the time when the blood was taken. For an example, we have taken the blood after the drug taken, and we have come to this point. Again after some time we have taken the blood and we come to this point. So initially if we see, the concentration of drug in the blood rises and eventually it decreases. This is certainly after which route of administration? Yes, this is oral route of drug administration, because if it's IV, then the chart would be something like this. So here, this phase up to this peak concentration, this phase is denoting absorption, and after that it's showing metabolism and excretion, that is elimination. Now another important points or some important short questions that can be asked, that what is Cmax? Cmax is the highest concentration of a drug into the blood. So which is the highest concentration? This point. So this point is the highest concentration of a drug into the blood. So this would be the Cmax, highest concentration into the blood of a drug. Now, what is C minimum? C minimum would be the lowest concentration of drug into the blood, and this would be the lowest concentration of a drug. Obviously, because drug gets eliminated. And what is T half? That is important thing. What is T half of a drug? So time at which the drug concentration reaches half of its maximum concentration. So this is the time to reach maximum concentration. This is the time to reach the maximum concentration. It is also called as T max. And time to reach half of the maximum is this. This is called as T half. Okay, so here is the time and it is T half. So half of the maximum concentration reaches at whichever point is called as T half. So hopefully things are clear now. And yes, the most important thing was this area under the curve. Now, what about this area? This area, this whole area is also known as area under the curve, and this is the bioavailability. Okay, so this area under the curve denotes bioavailability of a drug. So if a drug has a higher area under the curve, higher bioavailability, lesser area under the curve, lesser bioavailability. So if we inject the drug intravenously, what would be the bioavailability? Bioavailability would be 100% because 100% of the drug directly reaches to the systemic circulation. You are giving drug directly into the veins or arteries and it reaches directly into the systemic circulation. So bioavailability is 100%. Next question as we discuss. And because of that, the fraction of drug reaches to the systemic circulation decreases. So these are two major reasons: incomplete absorption and phosphorus metabolism. They ask you in examinations, then factors obviously would be these two. One, factor affecting absorption that we have discussed, and second, the first pass metabolism. Now we have already discussed and we already made a video about what are the different factors affecting absorption. Still I'm going through quickly. The solubility, more the soluble, better the absorption, more the concentration, better the absorption, higher the area and the vascular area will increase the rate of absorption. After giving the drug orally, there will be different things that interfere with absorption. For example, presence of food, particle size, vacuum and the acidic and basic nature of a drug. There are also some juices or HCl that decreases the drug into the stomach, and for that we need to modify those drugs. There are some also pumps in the gastrointestinal tract that are called P glycoprotein that basically pumps out the drug. Drug-drug interaction, if you are introducing two drugs, and alteration of gut flora, especially if the drug is undergoing enterohepatic circulations. So we have already discussed about different factors in a separate video which affects the absorption, and those are the factors which will also affect the bioavailability, because bioavailability depends on two things: absorption and first pass metabolism. So let's talk about first pass metabolism. It's basically a metabolism of a drug before reaching into the systemic circulation. Wolf and human. And what is the result of that? Lower bioavailability and shorter duration of action. So here you can see we have given drug orally, it reaches first to the liver, where it gets metabolized, that is called first pass metabolism, and then after it reaches to the rest of the body. Okay. Now if we give drug IV, this area will bypass and drug directly reaches to the body. So if we give drug IV, drug directly reaches to the body, bypassing the liver and first pass metabolism. And that is why in emergency situation and in situations when we want to see higher concentration of drug, we always prefer one more terminology in this bioavailability is bioequivalence. Now, as the name suggests, bioequivalence. Two products, two biological products, product 1 and product 2, if they are biologically equivalent or not, or their bioavailability is equivalent or not. So, if we are having, for an example, product 1, which is having bioavailability, and we are having product 2, which is also having its bioavailability. So statistically we need to see the difference between these two. If the difference between these two is not statistically significant, that means there is no much of difference between product A and product B, then these two products are called as bioequivalent products. Okay, so these kind of research you can say, or bioavailability studies you can say, been done in different CROs, and these CROs do this kind of BABE studies, bioavailability, bioequivalence studies, and check the differences between the two products. They see whether it is statistically significant or not. If the difference is not statistically significant, those two products are bioequivalent. Now, why bioavailability and bioequivalence are important clinically? So there are mainly two things, and most important thing is narrow safety margin. Now we will discuss this narrow safety margin in detail, but if I talk about this thing in briefly, I would say narrow safety margins means drugs which are having a lesser safety profile, less safe drugs. Okay, these drugs are called as drugs with narrow safety margin. Means if we increase their concentration even in microdose, okay, even in microdose, if we increase their concentration, there are chances of toxicities. Okay, and if we decrease the concentration, there are chances of failure of treatment. So the window or the margin between side effect and effects is very less, and these are called as narrow safety margin drugs. In cricket we called as safety margin. Sometimes you have heard in commentary that margin of error is very less, means you need to be very accurate. Same way here, you need to be very accurate in the drug concentrations. For an example, digoxin we use in congestive heart failure, oral hypoglycemics we use in diabetes. We need to be very accurate in maintaining their concentration in blood. If we fluctuate their concentration, there are chances of either side effects or there are chances of decrease effects. So margin is very less, and these are called as narrow. And in this kind of narrow safety margin drug, bioequivalence and checking bioavailability is of very much important. Antibiotic failure, sometimes we give antibiotic and we do not get any responses, so this kind of bioequivalence studies or bioavailability related studies becomes really helpful in detecting the results. So hopefully things were clear from my side. If you are having any doubts, you can comment in comment section. Thank you very much.